Enrico Cagliero and I work at Mass General Hospital. So what is arterial peripheral disease? It's kind of a disease of the arteries, the large vessels in the legs, and it's part of the same disorders that you can have in the arteries in the heart that can cause heart attacks, or in the arteries in the brain can cause stroke. And if the disease happens in the arteries in the leg, it can cause decreased blood flow and eventually can cause ulcers and lead to amputations. There are a number of risk factors that are typical for arterial disease in general, and one is smoking. There is a very strong risk factor for especially peripheral arterial disease. High blood pressure, high cholesterol, and diabetes are other risk factors for this disorder. The common symptoms for peripheral arterial disease are pain in the legs that happens usually not at rest but after walking at different distance for individual patient, and then when stop walking the pain goes away within a few seconds to a minute. Now, there are also patients that have peripheral arterial disease and have no pain whatsoever, but the majority have some pain that is not at rest, but just when walking. So the tests that are available to diagnose peripheral arterial disease vary. So the first is just a physical exam in which a healthcare professional can check the arteries in your legs and feet to be sure that they are normal. And then it comes to other tests like ultrasounds, in which can measure the blood flow in the legs. There are other tests that are like blood pressure cuffs, again measuring the circulation in the leg and measuring the blood pressure in the legs and comparing that in the arm to see if there is a blockage in the leg. And then the most complex tests are MRI or CT scan, in which there is a dye injected in the arteries and can see if there is good blood flow in the legs. So someone with diabetes can definitely reduce the chance to develop this disease by, first of all, quit smoking, which is the strongest factor, taking good care of blood pressure, lowering cholesterol, and keeping the blood glucose levels as close to normal as possible. The treatment options available for someone that has peripheral arterial disease are varied. So there are actually one of the most effective ways is exercise. An exercise regimen, usually supervised, but can also be done at home, helps by increasing the blood supply to the legs to decrease the symptoms and keeping the blood vessel open as much as possible. There are there are 2 FDA-approved drugs, pills that are available, but they are, in a number of studies, they were less powerful than exercise. And then for patients that have severe disease, then intervention that could be stenting, going with a catheter in the arteries and opening the blood vessels and putting, usually is a mesh that keeps the vessel open, is a good alternative. And also the most definitive procedure is doing surgery, doing a bypass surgery, like the bypass in the heart. In this case, would be a bypass in an artery in the leg. The drugs that are available to treat the disease work with 2 ways. One, drugs like aspirin can help a little bit by thinning the blood and so helping the blood supply, although again some studies show that it works and some studies show that perhaps it doesn't work that well. And then there are drugs that work on the muscle that are in the layer of the arteries by trying to dilate and enlarge a little bit the blood vessel and allowing more blood flow into the legs. Again, there are drugs that are not incredibly effective, but they can help someone that has initial symptoms of the disease. Walking is the best exercise, and so usually the patients, they go for the supervised regimen is walking on a treadmill for a certain distance, depending on when the symptoms come and what are the limits. Otherwise, if people do this at home, or they again walk until they develop the pain, then they rest, and then they can, when the pain goes away, they can keep walking. And if you do that on a continuous basis, eventually you can see that one can walk longer without developing pain because the blood vessels and the blood supply to the leg increases.